Hello, my name is Dr. Zakry Onn Yahya. I'm one of the consultant general surgeons here in Park City Medical Center. Today we're talking to you a little bit about abdominal hernias. Abdominal hernia, simply put, is a protrusion of your intra-abdominal organs or the intra-abdominal fat through a defect or a hole in your abdominal wall, causing a lump that occurs below the skin. Usually, somebody with a hernia would present with a lump that they notice, and the lump is usually what we call reducible. It tends to protrude out when you're standing or sitting, and once you lie down, it subsides. There are a couple of factors that causes abdominal hernia. First of all, in the abdominal wall, there is either a natural opening that you have since birth, for example, at the umbilicus or at your inguinal area, that causes the contents to protrude through these natural openings. Another one would be because of a weakness in the abdominal wall, such as what happens in old age when the muscles of the abdominal wall is weakened, or after surgery, which causes a weakening of the abdominal wall because it has been cut open. Another contributing factor would be raised pressure in your abdomen, such as somebody who has constant coughing or asthma, okay? Somebody who has to strain when he passes motion, chronic constipation, and sometimes difficulty in passing urine as well. Usually once a hernia occurs, it does not heal by itself. There is no medication or things you can take orally to make a hernia or the defect or the hole close. So the options for treatment for abdominal hernias is basically surgery. Okay? And when you talk about surgery, there are two types, which is the traditional method in which an incision is made over the lump and the abdominal contents are pushed back into the abdomen, and then the defect or the hole is closed with a mesh, a special material which causes hardening of the abdominal wall. The other approach would be through a laparoscopic approach, in which you have a smaller incision or scar where the hernia is fixed from the inside of the abdomen. If the hole in the abdominal wall is large enough, the hernia may persist throughout life, not causing any major problems. Some people live with these hernias, but sometimes when the abdominal wall defect or hole is too small, so when more and more contents of the abdomen, such as the intestines or the fat, get stuck in this hernia, and that causes a lot of problems. It can cause obstruction, as in the patient will develop pain, he'll be unable to pass motion, and some instances when it's very badly stuck, it becomes strangulated, and the intestines or the organs inside may die, requiring emergency surgery. To prevent getting hernias, basically you need to reduce anything that causes a rise in your abdomen, abdominal pressure. Such as make sure you don't cough chronically, make sure you don't smoking contributes to coughing. Make sure your asthma is controlled. Make sure you have no difficulty in passing urine. Alright, so in summary, an abdominal hernia is something that happens quite often and is very common. It may cause you a lot of problems later in life if it's left untreated, and we would advise surgery for abdominal hernias which cause pain, obstruction, and difficulty in passing motion. So if you develop symptoms and signs like I mentioned before, like a lump which is reducible and causes you pain, come and get yourself checked up here at Park City Medical Center, and we would like to give you the appropriate treatment if possible. Thank you.